in listen-only mode.
Hi, everyone. Thanks for tuning in to today's webinar. My name is Sharon Worrell, and I'm with Fight Colorectal Cancer, and I'm pleased to work with the rest of our team, Michael Sola, Danielle Burgess, Andrew Wortman, to bring you today's webinar. Our key expert today is Mary Dora Shank, and she's going to be talking about the 80% by 2018 initiative. After the webinar, the recording and a copy of the slides can be found in the webinar archives. You'll also receive an email to take an evaluation survey about the webinar to receive an iHeart Booty bracelet. Don't forget to follow our hashtag on Twitter, hashtag CRCWebinar, throughout the presentation. And to ask a real-time question, you're able to write them in the panel on the right side of your screen, and we'll address those questions at the end of the presentation. So just want to call out a couple of Fight Colorectal Cancer's resources. Your Guide in the Fight is a guide for late-stage patients going through information from diagnosis through survivorship and a whole bunch of resources. And then we have our Tabooty podcast, which is a podcast dedicated to topics that are taboo, hard to talk about, and just plain interesting. And a disclaimer, Fight CRC is providing webinars and all educational components as a means to help support you through care and symptom management. And none of our resources are to replace medical care. If you are experiencing an emergency, please utilize the 911 system and call your doctor. And finally, I'm so happy to introduce Mary Dora Shank. She's currently the director of the National Colorectal Cancer Roundtable, an organization co-founded by the American Cancer Society and the Centers for Disease Control and Prevention to bring like-minded organizations together for the purpose of increasing colorectal cancer screening rates. In her capacity with the Roundtable, Mary helps advance colorectal cancer control strategies, including advancing the shared goal of achieving 80% screened for colorectal cancer by 2018. We're super excited to have Mary on the webinar today, and with that, I'm going to hand off the controls so we can begin the presentation.
Okay, can you, oh, there it is. All right, can you see the slides?
Yes, we can see them.
Okay, great. Well, thanks everyone for joining. I'm Mary Dora Shank. I'm the director of the National Colorectal Cancer Roundtable, and I really appreciate the invitation from Fight Colorectal Cancer to share an update on the 80 by 18 effort and to spend a little bit of time talking about the role of survivors and caregivers in this shared goal. So we have a lot to talk about today. We wanted to spend a little bit of time just level setting, talking about what the National Colorectal Cancer Roundtable is, what is the 80 by 18 goal, and then I think getting into a bit more very specific advice on what we know about moving the unscreened to action, the roles that caregivers and survivors can take, and then I think the question that we get all the time is, is this actually working? And then if all goes well, we'll have a little bit of time for Q&A. So first, just to level set about the National Colorectal Cancer Roundtable, we were co-founded, co-supported by the American Cancer Society and the Centers for Disease Control and Prevention almost 20 years ago. We like to say we're an organization of organizations. We have about 100 roundtable members who have applied and been accepted for to be a part of our group, and we try to bring many different perspectives and approaches to the table. So, our membership includes everyone from medical professional societies to federal agencies to state health departments to cancer centers, all working together with sort of a laser-like intensity on trying to increase screening rates. And of course, Fight Colorectal Cancer has been a longtime roundtable member, and we've benefited immensely from the participation of Fight CRC. Angie Davis has been, your president, has been on our steering committee and currently co-chairs our public awareness task group, and we've been getting to know the team quite well, and just been so impressed and continue to learn from the work that you guys do every day. So sometimes it helps when I'm trying to explain what the Roundtable does to talk a little bit about what we don't do. And one thing we try not to do is to duplicate the role of our member organizations. We like to say that there's enough work in public health to go around. We don't need to be competing with each other, stepping on each other's toes. So if Fight CRC is sort of running with an effort, we'll step back, we'll help promote it, but we're certainly not going to try to compete with Fight CRC as an organization, and that's true for all our members. Rather, I think the Roundtable is at its best when we're advancing or trying to solve problems that everybody is sort of stumbling over at the same time, or you know, if there's a success that we need to replicate. We serve our membership best when we provide that opportunity for everybody to come together, to leverage each other's efforts, to speak with one voice, or work collectively to solve problems. We actually do our work through several different and very active task groups. You know, each of these task groups have sort of a different flavor, and we have volunteers who try to solve different problems, everything from helping to educate professionals, to increase public awareness, to answer pressing policy questions. You know, each of these task groups sort of takes on a different piece of the puzzle in trying to increase colon cancer screening rates. We are known for producing various tools and resources. All of these are available at nccrt.org and are available for all to use, whether Roundtable members or not. And the idea is that we often try to pull the best of what's working and sort of repackage this. So we learn from our members every day about what works. We try to pull it all together into some reasonable package, and then we push it back out. That way we all learn from each other. Often these books and resources that we produce have touches from many different organizations, so they approach problems from sort of a 360 perspective, which I think helps all of us get our work done. And one of the things that the Roundtable has been working on of late is this really ambitious goal to get to 80% screening rate by 2018. And when I talk about 80 by 18, it's been an amazing experience with so much support from so many different organizations. It's sort of fun for me to think back to the early days of when we were just starting the 80 by 18 effort. And what happened was the Assistant Secretary for Health at the time, this was back in 2013, Dr. Howard Koh, he brought together a number of different organizations, including many members of the Roundtable, and expressed some impatience with how we were doing with colorectal cancer screening. There's no controversy around colorectal cancer screening. We know it works. It's a widely embraced public health tool that can truly save lives, and yet rates had plateaued when Dr. Koh had brought us together. Rates were about 58, 59% in 2010, and they were that same rate in 2013. So he challenged us to come up with a bold and audacious goal around screening. And the Roundtable sort of took that to heart. And we met, the steering committee of the Roundtable met in July of 2013. And a very dear friend of ours, Dr. Jim Hotz, who works with a community health center in Albany, Georgia, proposed this goal to get to 80% screening rate by 2018. And I think there was something about it that immediately resonated with the steering committee. It was bold, it was audacious, it made us a little bit nervous, but I think we all felt that this was something that we could achieve. And no one was a bigger advocate than Angie Davis. She actually helped us get the pro bono resources to design this beautiful logo that I just showed you, that our 80 by 18 symbol, and was a real help to us as we sort of thought about what it would mean to have this shared goal and how do we actually implement that into action. It was not without some trepidation. We worried a little bit that 80 by 18 was too ambitious. Would it alienate organizations if their screening rates weren't so great? But we felt that there was a lot of reasons to try to launch this 80 by 18 goal. Most importantly, it was because we know screening works. Like I said, there's no controversy. We know screening is a life-saving exam. And the problem is not that we don't know what to do, it's that it's sort of a logistical problem. How do we make sure that all those folks that should be getting screened are actually doing so? We also thought the 80% goal made sense because we felt it was achievable. When you look at some of the best systems in the country, like the VA or Kaiser Permanente, they've been at 80% for a few years now. So this wasn't some utopian goal that we were never actually going to achieve. This felt like we could actually do it if we all worked together and if we all did our part. Most notably, the Affordable Care Act had just passed, which increased access to screening and made it more accessible in a way that had never happened before. And notably, Massachusetts, the one state in the nation which has had universal healthcare coverage sort of longer than the rest of us, they were closing in on 80%. So for all those reasons, we felt that 80% was actually achievable. And then this beautiful number right at the end, 203,000 lives that could be saved if we were to achieve this 80% screening rate. And I think that's something that inspires us each and every day. So like I mentioned, when we launched this goal, we really didn't think it would, we had no idea what to expect in terms of whether or not it would catch hold. But our chair, Rich Winder, presented the case for why we should try to achieve 80 by 18 now to the Roundtable membership in November of 2013. And it really took off like we could never have imagined. Our initial goal was relatively modest. You join the 80 by 2018 effort by signing a very simple organizational pledge saying you commit to sharing your talents and resources to advancing this goal. And our initial goal was just to have 50 organizations sign the pledge. And I'm delighted that as of this past March, we have 1,500 organizations. This is in large part to the work of the members of the Roundtable who often bring in other partners to sign the pledge, and most definitely to ACS Health System staff. The American Cancer Society has over 600 staff in communities where their job is to build relationships with clinics and hospitals and coalitions, and they do that and they do it really well. And they've done a lot of work to convince these organizations to sign the pledge and be a part of our effort. We're also seeing, we've also reached a new milestone in that we have pledges in all 50 states, including also Washington, D.C., Guam, and Puerto Rico, which we're extremely proud of. But as you know, a question we get all the time is, just signing a pledge, does that really mean anything? And so we have worked really hard to really define what the role is that everybody can play. How can you do your part to be a part of this effort? And so in the summer of 2014, we went through a fairly robust strategic planning process. And we came up with 4 main points of the 80 by 18 effort, 4 main objectives. And I'm going to focus most of my time today on sort of the consumer side. How do we move consumers to action? How do we get the unscreened screened? But there's a whole other arm of what we do that focuses on working with all those systems that actually touch the patient or touch the consumer to help ensure that they use their power to get folks screened. So we do a lot of work with healthcare providers, with health plans, with employers, with hospital systems, so that they can use their incredible assets and resources to make sure that each and every patient that they see gets screened for colorectal cancer. And then we also have a focus on policy. How do we make sure that we keep access open to colorectal cancer screening, that we remove barriers to screening, and then finally process. How do we maintain our momentum? This is a multi-year goal. How do we keep our momentum high? And then how do we evaluate along the way to make sure that we keep make sure that we're using our assets in the right way and course correcting if we find out that some things that we're not quite achieving the way we want to. So with all that background, you are probably asking yourself, well, what is the role of a survivor or a family member in this effort? And most definitely, I think survivors and caregivers have an authenticity that has the power to make the importance of screening real and to make it personal. And I'm going to share with you a little bit of market research that we did that hopefully will help underscore the importance of you telling your story and being ambassadors for screening. So if I were to think about our market research in one phrase, I would like to quote Sue Dorshank, who is my mom, And her phrase to me growing up was, "Don't make me tell you again." And unfortunately, this is sort of the way it is with getting the unscreened screened. When we looked at and talked to over 1,000 unscreened individuals, they sort of know about colorectal cancer screening. General awareness about colonoscopy and other tests is high, but for whatever reason, they've not yet turned that corner to embrace screening. And we spent some fair amount of time in this in the early stages of the 80 by 18 effort of doing some robust market research sponsored by the American Cancer Society in close partnership with the Roundtable's Public Awareness Task Group, which, as I mentioned, is co-chaired by Angie Davis, and then also working very closely with the CDC. And I found sort of a summary, this quick summary of barriers to screening to be quite enlightening. Affordability actually rose to the top as the #1 barrier to screening, and this was sort of new. Typically, we're not seeing affordability as a main reason people weren't getting screened. But I think about the time that we had launched the 80 by 18 goal, there were some high-profile stories about the high cost of colonoscopy. So I think that was beginning to break through to the unscreened, and certainly cost can be a very real barrier in screening, so that we're seeing that in our market research come through loud and clear. We also heard a lot about that this idea that screening is something you do when you're well wasn't really resonating with folks. People often cited that they didn't get screened either because they didn't have any symptoms or they didn't have a family history. So they needed a little bit of education. It wasn't quite clicking that this is something you do when you have no symptoms. We also heard a lot about competing health concerns and other issues in general. So, people, while they sort of knew about the need to get screened, this wasn't a top priority or a big concern of theirs. We also heard a lot about negative perceptions about the test itself. Colonoscopy is a great test, but for some people, that fear of a colonoscopy was very real, whether it was because of the invasiveness of the test or because they found it embarrassing. That was a very real barrier that the unscreened were telling us about. And then finally, these bottom two weren't necessarily a surprise to us, but I think it helps to underscore them, is that we've been hearing in research for years that my doctor does not recommend it was a huge reason why folks weren't getting screened. And in our research, we found this was particularly strong amongst African Americans and Hispanics. So what we did after we did that initial round of market research is that we worked with our public awareness task group and we came up with our priority audiences. So who is it that we need to reach about screening? And we came up with the buckets that you see here. Now, the rationalizers, procrastinators, those are the people that will drive you crazy, because on paper, there's no reason they shouldn't get screened. They often know about screening. They often have insurance. It was shocking to me to learn that 70% of the unscreened actually have insurance. And so I think we felt that these were people we needed to speak about in a more emotional, more creative way to get their attention and to move them to action. We also wanted to prioritize the newly insured because there were so many issues that we heard around affordability. We felt that we had a real opportunity with the Affordable Care Act to move folks from sort of a state of being not screened to being screened because they now have access to screening for the first time. The third group, economically disadvantaged, this is always a challenge in the work that we do. So how can we help those who are struggling financially to get screened? And then, of course, there's sort of overlap between these three buckets, and we wanted to pay special attention to various subpopulations where we need to do better. So Hispanics, Asian Americans, and American Indians all have notably low screening rates. And then African Americans, while their screening rates are better, they also this priority population has incidence and mortality rates. They get cases of colorectal cancer more than the rest of us, and then they actually have, they die from colorectal cancer more than the rest of us. So I think that creates a real sense of urgency to try to reach these different audiences and save lives. So after we sort of came up with a better understanding of our barriers, and we came up with our audiences that we wanted to prioritize, we did what I call sort of a message test-off. We came up with help from the Roundtable task group, we came up with several different messages that we wanted to test with unscreened audiences to see what moved them to action. And I think I was most surprised by the very first message. These are the top 3 messages across all the audiences. And the first was that there are several screening options available, including simple take-home options. Talk to your doctor about getting screened. So while that surprised me, it makes sense when you think about it. When you realize what a barrier affordability is, and when you realize that colonoscopy itself can act as a barrier for some people, this idea that there are tests that they can do that are much simpler, that they can do within the privacy of their own home where they have a lot of control, was extremely important. The second message that tested really well also makes sense when you think about what we learned from the barriers. This idea that colorectal cancer is the second leading cause of cancer death, yet it can be prevented through screening. So, you know, as we mentioned when we talk about the barriers, this is not real to people. They really don't think that it's not a top concern or pressing priority. But when you share sort of a scary statistic like this, that it's the second leading cancer killer, it gets people's attention. But you're not just leaving them hanging. You're combining them with a very clear action step. It can be prevented at an early stage through screening. So that get folks' attention, but give them something to do about it was quite powerful. And then finally, we talked about affordability. So the idea that there are affordable testing options available was really important to some members of our audiences. So that was a very quick summary of a huge amount of research. So if you're curious as to what else is out there, we packaged that into a communications guidebook, which is available for free on the Roundtable website. It's got a wealth of information. So if this is at all an area of interest to you, I welcome you to check that out. I will say that one of the drawbacks of the initial round of market research was that it was only with English-speaking audiences. And so that bothered me because we said we wanted to reach Hispanic Latinos, and that we recognized that our screening rates amongst this group were fairly low. So I was very grateful in 2015 when we received some funding from CDC to do market testing in Spanish with many unacculturated and bicultural Hispanic Latinos. And you know, more information than I could share in today's webinar, but I'm happy to take a few questions if there's interest from the group about you know, specific perceptions and barriers that we heard about when we spoke to this very important audience. Similarly, and along those lines, we worked with a researcher named Dr. Karen Kim from the University of Chicago Center for Asian Health Equity, and she had been working with CDC grant to do an incredible amount of research with different Asian American subpopulations and specific cultural and language barriers that they face to screening. So we created a similar guide targeting this important audience as well. And again, if there's interest, I'm happy to delve in more. But you know, kind of bringing it back to the folks on the phone, survivors and caregivers, and what your role can be, I wanted to bring your attention back to an item that came up in our market research that I had never seen before. And when we looked at this idea that the unscreened have other things that they are worried about, they're just not worried about colorectal cancer, one of the things that was really new and interesting was this one right here, that the unscreened are much less likely to have a personal connection to cancer. So they have never seen this battle up close. It's not real to them. And I think that, you know, just really underscores the important role that you on the phone can play, that telling your story and letting folks know that this can happen, and yet there's something that you can do about it is really important, and we're so grateful when folks do take that upon themselves to talk about their own story. And just to underscore a few more slides about why this is important, the unscreened, they're an interesting bunch. They consider themselves to be healthy at about the same rate that the screened do, but they're not necessarily going to the doctor. They in fact, avoid it as much as possible. And so this idea that you have a role to talk to them, they may not be going into the doctors to get that message about screening. And so if you can sort of be a gentle touch to open their eyes a little bit and let them know that this is important, you know, we need to find another way to get to this group beyond just the doctor's recommendation. Similarly, and this was also very important, we found that logical messages alone don't work. So the screened are what we call early adopters. If you sort of tell them what they need to do, you know what, this is recommended for folks your age, it's a way that you can be proactive about your health, the screened will go and do it just based on that very simple request. The unscreened, they're a little bit tougher. These logical messages, they don't work as well. We need to get their attention, whether it's through emotion, whether it's through humor, you know, so what are the ways that we can reach out to them, and what better way to get their attention than to kind of go beyond that logical story to talking to them about very real and personal experiences. So I guess my one big takeaway is that, you know, you have the power to help break through the clutter, to make it real and relevant and personal. You know, hopefully everyone on the phone has heard about the Kerak Effect, where back in the early 2000s, she had a colonoscopy that was shared on air. And there was actually a scientifically documented progress on screening where the uptake of colonoscopy use went up that year, and it was actually called the Kerak Effect. So this idea that individuals can make a true difference and get people's attention is really powerful. On this screen is one of my heroes, a dear friend of ours, Karen Walsh, who is a Broadway actress, and she's currently fighting the disease, and she has been a real champion for the 80 by 18 effort. This is actually taken one of many photos like this where she gets her Broadway friends together and they create a theme for each chemotherapy session. And then she shares these on her Instagram account, and she combines these with messages about the importance of knowing your body and screening. And it's just been amazing to see this go viral. She's done several different sort of mini videos that have had views in the hundreds of thousands. And then here's another hero of ours, whom some of you might know, Candace Henley from the Blue Hat Foundation. She was one of our 80 by 18 National Achievement Award winners as a survivor champion. And, you know, again, just the power of what one person can do. Candace had stage 2 colon cancer, was facing, you know, horrible financial troubles that were caused by her cancer diagnosis. But she sort of had a turning point when she found out that she actually had a family history of the disease that she was not aware of. And that really helped Candace, you know, figure out how to turn, you know, this, you know, sort of tragedy into something extremely positive. She has a saying, you know, family secrets can kill. So this idea that, you know, we all have an obligation to spread the word about the, you know, making sure our family members know about our own diagnosis, and that doing more to encourage conversation and promoting awareness about screening. So Candace went from, you know, being someone who was really in quite a state of trouble from or trauma from the disease, to actually launching her own foundation, the Blue Hat Foundation, and activating in 15 different churches a Blue Hat Bow Tie Sunday, where everybody dresses up in blue and their Sunday best, and they use that to prompt education about colorectal cancer screening. So she's definitely one of our new heroes, and a real testament to the power of what individuals can do. So what is your role in all this? We have that brief that I mentioned, and, you know, I think there's roles that all of us can play. You know, we may not be quite as ambitious as, say, Candace and you know, launching our own foundation, or you know, as Karen Walsh, you know, we may not be able to get our Broadway friends together to do, you know, these creative costumes, but there's something that each of us can do. So it may be as straightforward as talking to your family, making sure that they know that they should probably mention that they now have a family history, diagnosed family history of the disease to their doctor, so they may be more aware if they need to get screened early, and to be knowledgeable about the disease. This idea that colonoscopy, we sometimes think of that as the only test, but we also know that there are many good tests out there, and maybe just learning about one of those other tests is what's going to move someone to action. So educating yourself about the different tests so that you can help people find the test that's right for them. Wearing the blue star. I wear my little blue star lapel pin all the time, and sometimes it's it's sort of an unexpected conversation starter. Someone will ask, well, what is that? And it's an opportunity for me to say, well, it's actually the symbol for colon cancer, and did you know that you can actually prevent this disease through screening? So just a little kind of small chance, but important chance. You never know who you're going to talk to at the right time, where they're going to get that message right when they need to hear it. For those of you who are more active in your community or have strong relationships with your churches or different organizations, we love your help in promoting the 80 by 18 effort, and perhaps gently suggesting that an organization sign the pledge. If they do, we're more than happy to provide advice on how they can use their power as an organization to do more. And then we know our friends at Fight CRC are some of the best in the business at sharing your stories with lawmakers and other public officials. I just can't underscore how grateful we are when you do go to the Hill and take that step of sharing your story, because you bring an authenticity and an urgency to this that that I can't do. And so we're very grateful that when you do find time to take those steps and make this a bipartisan issue. So I'm looking at the time a little bit, so I'm going to jump through a few of these slides, but Sharon can share those, all of you, with a little bit more specifics about reaching some of those target audiences. Just to kind of sum up what the recipe for success is that some big takeaways, sharing your story can help connect the unscreened to colorectal cancer. Please work to engage your family and your community networks, because you can help articulate the need for screening and make it relevant. And I think one other thing I didn't talk about a lot is just your ability to destigmatize this test. If you tell folks, I've had 1 million colonoscopies, they're not that bad, the prep, it's fine, you'll feel really skinny afterwards. If you can kind of help people conquer that fear and help them kind of turn that corner into being ready to accept the need or the importance of screening in their lives, that's a huge service. And then I can promise you that we will help reinforce those messages, so that when you've planted the seeds, about the need for screening, if they do come into the doctor's office, we're really working really hard to make sure that when patients do get in to the primary care office, they're sort of ready to accept that message from their healthcare provider. And so making sure that we save time for the question we get all the time, is the 80 by 18 effort working? And there is something a little bit frustrating about colorectal cancer screening and the data, and that is because we don't know how we're doing in 2017 until almost a year and a half later. So even though it's 2017 now, we're just now finding out how we did in 2015, so right when this effort first got started. But I am so delighted to share with all of you that rates are beginning to rise. So now I'm going to get a little bit of wonky, go a little bit wonky on you guys, so bear with me. But this is one of the measures that we track, and it's called the UDS measure. So we work very closely with community health centers. Community health centers are all over the country, and they serve millions of low-income individuals in sort of often rural and underserved communities. They have an amazing mission. They never turn away anyone from their doorstep. And the idea of community health centers is that they serve whoever, they try to meet the basic healthcare needs of whoever walks in their door. And we've had great partnership with community health centers all over the country, and they've really embraced the need to get all their patients screened for colorectal cancer. And we've seen some beautiful increases since we started working more closely with community health centers and their leadership. and screening rates have gone up steadily over the first couple of years of the pledge, up 2%. And then there was this beautiful jump between 2014 and 2015 where rates went up 4% in a year, which is really quite phenomenal. And that actually translates into 300,000 more patients getting screened for colorectal cancer. Here's another wonky term for you guys. The HEDIS screening measure is another one we track. This is the insured population. So this is health plan rates for 2015. And this one is a little bit of a mixed bag. We see that screening rates are going up for the Medicare population, really nice increases here, 67%, 66%, but rates were stagnant amongst the commercially insured, so that 50 to 64 population. So that tells us that as we sort of turn the corner into 2017 and 2018, we're going to need to do more to focus on that insured population. And then here perhaps is one of my favorite slides of the webinar. Keeping in mind that when we launched this effort, you know, if this slide should actually include 2012. So this is a national screening rate for colorectal cancer that's tracked by the National Cancer Institute. And screening rates were flat, as I mentioned earlier, between 2010 and 2013. But look at this beautiful jump into 2015. Rates went up 4%, which is almost unheard of in 1 year, particularly after a plateau. So what does that actually mean? And here are the numbers that should make all of us really, really proud. When rates went up that much to 63% in 2015, that meant in 2014 alone, almost 4 million additional adults over 50 were screened for colorectal cancer. So what does that mean in terms of lives saved, which is what we all feel so passionately about? That means that if we hold that rate, if we stay at 63%, not even getting up to 80%, if we just hold our progress, we will have saved 37,000 lives from colorectal cancer. So I think this is why we all do what we do. But just close your eyes for a second and envision a stadium where there's 37,000 people and realize that that's the type of difference that we're all collectively making, each by doing our little part. So if you ever worry that it doesn't make a difference, it does. And it's made us so happy to see this type of progress because it's just so important. But as I mentioned, we're always trying to do better and understand where we need to improve our work. And this slide here shows where, you know, in addition to sort of that, you know, insured 50 to 64 population, other populations where we need to sort of double down and do more. This is the National Health Interview Survey data, but along racial and ethnic lines. And so you see that whites had a really strong jump between 2013 and 2015, a steadier increase amongst African Americans, but we're still struggling with Asians and Hispanics. Asian Americans were almost flat. And so I'm so relieved that we now have, you know, a better understanding of how to do better and speak to that, you know, address barriers that the Asian populations are facing, so that we can get that screening rate up off the plateau that that they are still on. And then Hispanic Latinos, you know, we did see an increase between 2013 and 2015, but still rates well below 50%. So we, you know, definitely need to do better and certainly look to our friends at Fight CRC to help with that in those two areas. So you can certainly learn more about 80 by 18 by going to our website. Again, all this stuff is free. We have done an awful lot of work on trying to figure out what's the role that each of us can play. So, you know, whether you're talking to a business or a hospital or a primary care doc, there's something that all of us can do. And we try to make these resources sort of, there's something in there for everybody. So, you know, if you're not quite sure, if you want to just do a little bit of education, we can put you to work. If you want to do something really ambitious, we have a ton of ideas, and all that's available on our website. So just to sum up, you know, this really is making a difference, and there's more that we can do. And so, you know, really appreciate, you know, any help that you guys can do to help us spread the word about this cause and about the, you know, important role that screening has in saving lives. And then just to close, you know, this all comes down to our individual relationships and the people that we care about. So these beautiful folks are my mom and dad. My mom, this was, this whole screening effort is, I think was really important, particularly for her. She has a brother who was diagnosed with colon cancer and a sister with rectal cancer. But thankfully, and for all those researchers that have been doing this for years, my mom got screened and had polyps removed. So she didn't have to go through that battle that she saw her brother and sister go through. And similarly, my dad, he took a few more years after my mom, but a little bit of nagging from her, and he eventually got screened. Same thing, they found some polyps that were removed, and now they're healthy and wonderful grandparents to my children, and a good reminder that while we're talking about very big numbers, this really affects the people that we love and we care about. And so that's it. I'm happy to take any questions, and really appreciate the opportunity to talk to everyone today.
Thank you so much, Mary. What a great presentation. I'm just going to pull up some questions. Give me just a moment. Okay. So just a reminder, if anyone on the line has questions, on the bottom right-hand corner of your control panel, you're able to type those in. And I'll go ahead and kick us off here. So question number one, is there any way for us to get involved with the NCCRT independent of an organization? If I have a comment or suggestion about the efforts, who would I contact?
So all are welcome to be on our 80x18 email list. Fight CRC is certainly a great partner, and we have a lot of other survivor groups as well. So they certainly I think help our effort. But you are more than welcome to get on our emailing list. Just you can email me, or you can email ncCRT@cancer.org, and we can add you. And I think that helps just kind of see what are the types of things that we're putting out there. We're always coming out with new assets. We just released a new tool on, what HealthKins can do about screening. So, I certainly appreciate that all of you on the phone have relationships with different organizations that you might be able to sort of help convince to be a part of this effort, or perhaps, you own a small business yourself that wants to be a part of this effort. So, we're more than happy to have the help and to share and to learn from, the contacts you have and the ideas that you have.
Great, thank you. Our next question, does the NCCRT only focus on those 50 and above? And what about those with a family history who recommendations suggest should get screened a little earlier?
Yep, that is a great question. And, I think while the goal is specifically focused on the over 50 population, the spirit of the 80x18 effort is certainly that we want to save all lives from colon cancer. The Roundtable has a very active family history task group, family history early onset task group that is, relatively new, about 3 years old. And we expanded the charge of that group to include early onset cancers within about the past year. So it is certainly, an area of great concern to us. We've been spending a lot of time working on a new module that will help clinicians do a better job making sure that they collect family history, that they know how to act on that family history, and that they do it in a systematic way. Similarly, with the under 50 population, with this increase in screening, we are sort of shifting how we speak about screening. We are encouraging doctors to talk to all patients about colorectal cancer to try to determine if they have a family history, or if they're presenting with symptoms, that they move that patient so that they get a proper diagnostic workup. I don't have to tell the folks on this webinar that a lot of the under 50 population get diagnosed at quite a bit later stage, and we need to do more to correct that. So those are, the new research that the American Cancer Society released last month are certainly on our minds, and we certainly feel a sense of urgency to try to do more And we're also sort of incorporating, we're changing our message a little bit to talk about knowing your body, so that it's not just this message of, you're 50, get screened. It's also know your family history, know your body. If you're experiencing symptoms, please go advocate for yourself and see your doctor and get a proper workup. So appreciate the question very much.
Yeah, great. Thank you, Mary. A couple more questions came in. Kickoff in 2018.
I'm sorry, you broke up just a little bit, Sharon.
Oh, sorry. Can we expect to see another exciting March kickoff in 2018?
Absolutely. And boy, that was so cool. So appreciate the question. For those of you who didn't get to see it, we hosted just an amazing event in partnership with Fight CRC with different celebrities and survivor speakers that was like nothing we've ever done before, to be honest. But we loved it, and we were so proud of the incredible reach of that event, and appreciate all the help that Fight CRC and Stand Up to Cancer and Mayo and Exact all brought to the table to make that a really special event. So we are already thinking about what March 2018 is going to look like. I know Angie Davis was thinking about this, as March 1st was happening, and we're beginning to have conversations. So we definitely want to try to top ourselves.
That's great. Good to hear. It looks like we have one final question that came through, and it's about employers. Oh, hold on just a moment. Okay, so yes, so can I get my employer to take the pledge? And are there tools for employers to raise awareness?
Absolutely. So we have a brief, if you just want to sort of get their feet wet, where we have a bunch of different ideas about how employers can play a role. And then we actually also have a larger handbook. So if an employer actually signs the pledge and they really want to kind of roll up their sleeves, we have a much more robust employer guide to help them think through the role that they can play. Because there really is something, every organization can do. It might be making sure that their own employees are getting screened. It might be if they interact with consumers, that they are, using their opportunity to raise awareness. And then there's other things like, working with their benefits department to making sure that the benefits that they offer their employees around colorectal cancer screening are strong and free of, cost barriers. So there certainly is a lot to do. And, on our website, we've got, got a brief that's a great place to start what employers can do to help with the 80 by 18 effort.
So to kind of piggyback onto that question, in terms of NCCRT tools that are available, do you have them available in languages other than Spanish and English? And if not, is this on the horizon?
So yes, great question. The Asian guide that we just released last February has messages. I have to double check. I think we have Chinese, Korean, Urdu, and there's one more that I'm forgetting. But that is something that we're working on. We do an annual survey of all of the partners that have signed the pledge. And one of the assets that was requested was resources in more languages besides English and Spanish. So we released sort of the first round of these with the Asian companion guide last February, and I'm hoping that more, more sort of in the pipeline.
Great. And finally, are there social media hashtags we should use to support 80 by 2018 online?
I am so embarrassed because there absolutely are, but I'm an idiot when it comes to social media, so it's not jumping off the top of my head, but I promise I'll get that to Sharon and to share with all of you. I think it's just hashtag 80 by 18, but I can't remember if it's hashtag 80 by 2018, which is why I have to, I'll have to get back to you guys on that one.
Yeah, I think based on our Twitter conversation, hashtag 20 or 80% by 2018, but we'll we'll check that out and confirm. Well, with that, Mary, thank you so much for taking the time to, share everything that you know about the initiative with Fight Colorectal Cancer and those on the line. And we really appreciate all the work that you're doing, and proud to be partnering. And thank you so much.
Yeah, enjoyed it. Thanks, everyone.
Thank you.